everyone! Welcome back to my YouTube channel. Pasensya na guys kung ganito yung boses ko kasi I have just recovered from a bout of flu and sabi nga nila, we always have to show up in the most difficult times. But whether it's about dermatology or sharing a piece of my personal world, I'm always here to bring knowledge and authenticity straight to you. So kung napanood nyo yung last 2 episodes ko wherein I talked about the skincare products that I use and the treatments and procedures that I have done and have been doing to age backwards, this episode will be a little different kasi pag-uusapan naman natin ngayon bakit kailangan natin gawin ang mga to, particularly the topics on collagen banking, Prejuvenation, and Rejuvenation. Medyo it can sound a little bit intimidating pero I will try my best to explain it in the most understandable way. So simulan natin with collagen banking. Ano ba talaga tong collagen banking? I'm sure you've heard of it. Some of you, especially yung mga mahilig sa skincare, narinig nyo na to. But it is essentially saving up for your future skin. So think about this as your collagen. So wait, ito may trivia ako sa inyo guys. Did you know that when you start to age, you lose on average about 1 to 2% of collagen per year? So ito yung tinatawag natin na intrinsic aging. Kahit wala ka pang gawin, kahit umupo ka lang or humiga ka sa bahay mo, every day, nagbabawas pa rin ng collagen. It eats out dun sa collagen na meron ka. And to add to that, on the other hand, meron din tayong tinatawag na extrinsic aging, which are those that we are exposed to on a daily basis na nagkakos ng aging. Ano-ano ba yung mga to? UV radiation, pollution, stress, and even lifestyle factors. So if you can imagine, if this is your collagen, you have intrinsic aging factors eating up sa collagen mo, and then you have your extrinsic factors eating up on this side. And if you don't do collagen banking, can you imagine what your skin will look like in the years to come? So parang ganun siya. So the concept of collagen banking doesn't mean naman na sobrang gusto mong bumata yung itsura mo. It's more like maintaining what you already have or preventing and slowing down the signs of aging from appearing. So meron kasing common misconception na collagen banking is applying collagen-containing products on your skin or sometimes even taking collagen supplements. Kasi I'm not against collagen supplements, but when you take kasi collagen supplements, there are no guarantees that it will go to your skin. It can go to other body parts that need collagen. So kung gusto mo talaga na yung skin mo talaga yung matarget and you want to do collagen banking, using skincare products and ingredients and doing treatments and procedures that stimulate your own body to make collagen are better options. So it doesn't mean na kailangan mong mag-procedures every week or mag-take ng kung ano-ano man maraming mga skin supplements in order to collagen bank. It just means that you have to find the right skincare routine for you, the right treatments for you, and be consistent about it. Which brings me to my second pointer, the difference between prejuvenation and rejuvenation. So let's start with prejuvenation. Yung word na pre means that wala ka pang nakikitang masyadong signs of aging sa face mo, wala ka pang major concerns, but you want to apply skincare products, do practices, and do treatments to prevent them from forming or slow them down. So normally, itong prejuvenation period would be around your early 20s to your mid-30s, wherein you employ proper sun protection, you are diligent and consistent with your skincare routine that is suited to your skin type and needs, and you may also do treatments like skin toning, skin boosters, yung mga ganyan. Rejuvenation, on the other hand, is the practice of trying to reverse the signs of aging that have formed on your skin, like fine lines and wrinkles, pigmentation, broken capillaries. So in rejuvenation, you also have to have a good and consistent skincare routine. Pero dito, marami na tayong pwedeng i-add like mga antioxidants, peptides, anti-aging compared to yung prejuvenation. And your skincare routine should always be paired with treatments and procedures that address the signs of aging. Ano ba yung mga to? Like mga skin tightening and lifting treatments, resurfacing treatments. You can also continue to do your skin boosters. And you may want to add mga biorejuvenating and bioremodeling treatments. May gusto lang akong i-mention kasi this idea was brought up by several patients of mine na parang nalilito nga sila dun sa mga ad campaigns that you see online where makikita mo na ang pinopromote na treatment is supposed to be rejuvenation and reversing the signs of aging. Pero yung mga makikita mo mga models, mga sobrang bata. So, ito yung concept na parang gusto ko talaga i-discuss, which brings us to my third pointer. Ano ba mangyayari kung sobrang aga mong mag-undergo ng treatments And ano naman ang mangyayari kung sobrang late ka na into the game? So let's start with sobrang agang treatment. Meron ako mga patients in their early 20s who came to me and then they said na, Doc, let's do botulinum toxin injections on the areas na commonly magkakaroon ng wrinkles before they appear. So this is the wrong concept of prejuvenation. Kasi when you do treatments too early, for example, let's talk about botulinum toxin injections on the forehead. So meron akong pasyente in her early 20s and she comes to me and she goes, Doc, injectan mo na ng botulinum toxin yung forehead ko para hindi na ako mag-form ng wrinkles in the future. So did you know that botulinum toxin injections cause muscle atrophy? Kaya nga, di ba, pag ini-inject natin siya sa masseter, liliit yung face natin. Pag ini-inject natin siya sa trapezius muscles natin, nag-elongate yung neck natin. Because injecting botulinum toxin into the muscles can cause muscle atrophy. So if you inject it on your forehead and wala ka naman movement pa, and you do it continuously, ninipis yung muscles mo in the forehead, which will make your blood vessels appear more prominent in the future. So that's not good. That's the wrong concept of prejuvenation. Prejuvenation is merely wanting to maintain what you already have and slowing down the signs of aging, but not in that way. So example, proper sun protection, applying sunscreen diligently, following a regular skincare routine, and doing treatments that sort of, alam mo yun, parang stimulate collagen remodeling but in a friendly way, like laser toning, for example. So prejuvenation is not a shortcut. Hindi ibig sabihin pag may nakita kang trend online, gagawin mo na or you're gonna jump on the bandwagon and just do everything. So it's not that. It's actually a long process that helps your skin maintain its healthy and youthful state. Sa rejuvenation naman, apart from what I mentioned earlier na doing treatments and procedures or applying skincare products that reverse the signs of aging that have already appeared, at the same time, we are also doing collagen banking. So gumagawa din tayo ng treatments that stimulate our own body to produce collagen. Para yung mga signs of aging that will appear in the future, madedelay din siya and masuslow down. What can we do to rejuvenate and prejuvenate the skin? So I'm going to provide a guide on what you can do in your 20s, 30s, and 40s. So ito lang guys, disclaimer ha. This one is a basic parang guide. Hindi siya nag-a-apply dun sa mga patients na may acne scars, may acne, or other ongoing skin conditions. Okay? So malinaw tayo dyan. In your 20s, very, very important to have a skincare routine that contains proper sun protection, maybe add antioxidants, and in your mid to late 20s, you can already start using retinoids. So very, very important din yung lifestyle. So hindi lang importante na nag-a-apply ka ng skincare products, you should also do sun avoidance and try to maintain a healthy lifestyle. In terms of procedures naman, you can do regular facials that exfoliate and soften the skin, maybe even infuse some ingredients. Number 2, pwede ka rin mag laser toning, like in general lang, parang to even out the skin tone, etc. And you can also explore skin boosters, injecting hydrating ingredients and vitamins into the skin. In your 30s, that's when you start to notice some signs of aging na nag-a-appear na. Kasi ganun yung nangyari sa akin eh. Naka-notice ako ng pigmentation and fine lines when I was in my early 30s. So apart from what you were already using in your 20s, you can already add other ingredients like exfoliants, even peptides, and you can also do treatments that are more specific or targeted. Ang example nito, yung nagkaroon ako ng pigmentation, I started like doing Q-switch and diag laser treatments to remove them. When broken capillaries started appearing, nag-vascular laser treatment ako. And this is also the time when you can start exploring maybe having botulinum toxin injections to target dynamic lines and prevent permanent lines from forming. And you can also start doing bioremodeling and biorejuvenating treatments like injection of mga polynucleotides, even mga hybrid cooperative complex treatments. And for some of you who want to address beginning loss of volume, for example, itong tear trough, ito talaga yung pinakamaaga na nag-a-appear or nag-age, you can also inject products into that area. Or if when you want to enhance like certain features, pwede mo din itong explore at this age. Now, in your 40s naman, where I am at right now, medyo nakakapansin na ako ng konting loss of elasticity in the skin sagging, and appearance of new lines. Like, in my 30s, wala pa akong crow's feet. Pero ngayon, ayan, kailangan ko na nga ng treatment kasi nag-a-appear na siya. And then again, because it's a process, we build up on what we were doing when we were in our 30s. So, in your 40s, dito ka na mag-start gumawa ng mga treatments that tighten the skin, have like a lifting effect, like yung mga energy-based devices, like your microfocus ultrasound or your monopolar and bipolar RF treatments. Doon mo na pwedeng address yung mga nadagdag na signs of aging na nag-appear. But you still continue doing your collagen banking by doing bioremodeling and biorejuvenating treatments. And at this age, I am still continuing to do botulinum toxin injections. So guys, you see, it's really a process. Hindi siya yung parang pabugso-bugso lang or biglaan if you really want to achieve healthy skin in your 40s. But again, remember, this is a general guideline. So ibig sabihin, if you have other skin concerns that are pressing and I did not mention here, kailangan mo pa rin mag-consult to get a tailored treatment for that. But okay, so napanood mo na to. Doc, paano yan? I'm already in my late 40s. I'm already in my 50s. Does it mean that I can't do anything about it or it's too late? So now we go to rejuvenation. Sabi nga ng lola ko guys, ang swerte daw natin ngayon because ang dami ng pwedeng gawing treatments that will address the signs of aging that are already there. So yung mga ngayon pa lang nakakapanood nito at ngayon nyo pa lang nalaman na meron parang mga ganito, don't worry, marami na tayong treatments na pwedeng gawin. So when it comes to rejuvenation, ako, how I deal with it is targeted lagi. Kasi, let's admit it, meron talaga mga tao na born with good skin genes na they're in their 50s, but if you look at them, grabe, they don't need botulinum toxin injections. That's why in my clinic in DERMHQ, this is the campaign na hina-highlight namin in 2025. Understanding who would fall under prejuvenation and rejuvenation. So, simple lang yan, guys. If you look at your skin and you don't have anything to address, you don't have any skin concerns, you will fall under prejuvenation. And when you are starting to see signs of aging, you fall under rejuvenation. But again, this is not based on age. It's really based on what we see in you. And we aim to provide tailored treatments to address what your skin specifically needs. So don't be surprised if you come to my clinic in your early 20s asking for botulinum toxin injections and I refuse. Kasi hindi lang yan basta-basta mag-inventa kami ng treatments or mag-offer kami ng treatments just so. In DERMHQ, we always make sure that what is given to you is what you need. Kasi meron talagang ganon, especially with all the trends. I mean, guys, I am not different from you. Whenever I watch TikTok or Instagram and may nakikita kong treatments, alam mo yung feeling na parang shocks, gusto ko siyang gawin or is that right for me? So that's why it's important to consult. Minsan, alam ko yung, nagigets ko yung nagtatanong kayo sa akin online, tapos ang sagot ko sa inyo, guys, please consult. Kasi it's not as easy as 1, 2, 3. It's really proper skin assessment, determining your skin type, your skin concerns, and of course, kung ano yung gusto mo. Kasi pag tinignan kita, tapos nakita ko ang dami mong lines, tapos wala ka naman palang pakialam, ayaw mo naman siyang i-address. Siyempre, bottom line is, and ultimately, the treatment that we will do is something that you want and something that I think you need for your skin. So, ganun lang tayo lagi. And it's very, very important to also understand kung ano yung gagawin mo, ano yung gagawin sa'yo, and kung ano yung long-term effects nito, and if it will benefit you in the long run, and if it's something that you want. Kasi may kanya-kanya naman tayong goals. Honestly, meron ako man na-encounter na patients who really don't want to address their signs of aging. They come here for something else, and even if meron ako na-notice na parang feeling ko pwede nating address, I wait. I wait until you voice it out as your skin concern. Kasi iba-iba naman tayo talaga. So collagen banking, guys, is real and it's important, but it doesn't mean doing all the treatments all at once. So prejuvenation and rejuvenation both have their time and place. Ang importante lang is doing these things at the right time. So, di ba guys, medyo intimidating talaga siya. But I do hope that I was able to explain it in a way na nagigets natin. Pero sure ako may mga tanong pa rin. So, don't hesitate to put them in the comments below if you want me to expound on a certain topic, if you want us to make another content related to this. We will be more than happy to hear suggestions from you guys. Thank you guys for tuning in to this 3-part series. Kung hindi nyo pala papanood yung episode 1 and 2, please try to watch them kasi mas maiintindihan nyo yung pinag-uusapan natin ngayon pag napanood nyo yung 1 and 2. And of course, if you enjoy this video, please don't forget to hit the like and subscribe button and turn on notifications para updated kayo sa mga next natin na videos. So that's it guys, and magpapagaling muna ako ng tuluyan. See you again in the next video.